Hi, everyone. Welcome to another episode of the Egg Whisperer Show. I'm super excited to do another call-in show tonight. We have a lot of callers signed up, and I'm just going to get right to it. And we're going to take our first caller right now. Hi, caller.
Hi, how are you?
I'm doing great. Thanks for calling in tonight. What's your name?
My name is Christy.
Christy, thank you for calling. So tell me what's going on.
So I am looking into doing two tests, the ERA test as well as the Receptiva DX test.
Okay.
And my question for you is, if you do both of those tests in the same mock cycle,
right.
What would the course be if the ERA shows that more progesterone is needed, and then the Receptiva test shows that the BCL6 marker is present, which indicates that you likely have endometriosis? My concern is that if we do treat for the endometriosis, either with the Lupron or with a laparoscopy,
right.
Would that alter the ERA test, and would those results still be reliable, or could the treatment of the endometriosis change the window of implantation?
Okay, so basically, you're someone who is following what I call the egg whisperer diet. Okay, so you've figured out your diagnosis. You've done IVF already, is that right?
Yeah.
Okay, and then now you're doing the E part. The E part is endometrial testing before you do your embryo transfer. So you're doing exactly what I ask my patients to consider. So that's really, really smart. Okay. So what your question is the following. You're talking about two tests that look at the endometrial lining. One is called the endometrial receptivity assay. And that test literally tells you how many hours of progesterone your body needs for implantation to occur. So this is the thing. When you do IVF, you're doing something that's quite artificial. Of course, there's a lot of nature involved when you're using science, but there are no two people that are alike. And we have genes involved in implantation, and everyone's implantation window is around 24 hours. And so what the endometrial receptivity assay does is it looks at gene expression for you. It is a genetic test, and that's why I'm pointing out that it's gene expression. Genetic tests don't change. And the company has done tests over time in the same woman and has said that the test is the test is reproducible over time. And I can tell you from my experience, I've actually repeated the ERA test for patients who've, let's say, wanted to also repeat their BCL6 test, which is the Receptiva test. And I'll talk a little bit more about what that test is in a second. But what I have found is that it is reproducible. So even if, let's say, your BCL6 level was elevated, and then you treated it, and then you repeated the ERA test, it's the same. Okay, but it's important for you to talk to your doctor because potentially they've had a different experience based on the protocols they're using for you. And it's like we all have a special sauce, right? So I have a protocol that I think works really, really well for my patients. It's not going to be the same protocol that maybe your doctor uses. I've been doing the endometrial receptivity assay since it was available, even before it was available clinically in 2013. And I've also been doing the Receptiva test for quite a bit of time as well. So your question, and I want to answer in detail, is about the Receptiva test. And for those of you who are watching who don't know what it gives you a histologic score for something called BCL6. And then you get a level. It's either 1.4 or below, which is considered normal. It can be over 1.4, for example, it can be 2, 2.5, which is considered mildly elevated. It could be between 2.5 to 3.5, which I still consider mild to moderately elevated, or it could be above 3.5, which would be moderately to severely elevated. So I have my own personal treatment protocol that I use for patients. So let's say you ran your ERA test, and then you did both the ERA and Receptiva and found out, for example, that your Receptiva score or your BCL6 score was 2.5. Well, what I would do is just a slightly different protocol using Lupron and Femara when you start your estrogen before your transfer. That's how I would deal with it. For some patients, maybe 1 month of Depo-Lupron if they have any signs, symptoms of endometriosis or adenomyosis. So that can also be used in conjunction with that protocol that I just mentioned. And then the ERA test results usually come around the time of that next lining check. And then the cool thing is that the Receptiva results usually come around when your period starts. So you can use that information to guide your protocol. The other thing that's really important is having a low inflammatory diet, for example. So let's say you're someone who has a high BCL6 level. Well, look at your body. You know, do you have a healthy BMI? Are you taking the very best care of yourself? So you've probably heard me say before that your uterus is the house for the most important VIP guest of your life, right? And so we want to make sure that you've done, and you're doing it, everything possible to prepare that house on the inside, but also think of what's on the outside as well. So making sure your blood pressure is low, your blood sugar is low, not low, but you know what I mean, in the healthy range. And then, making sure that you are taking care of yourself as much as you can. And I definitely promote rest, relaxation, and meditation to also decrease inflammation in the body. And I have someone who's chatting right now. Does your receptivity change over time? And should you redo the Receptiva and ERA tests again if your transfers are years apart? And my answer is yes. So in my experience, I have had cases where I've had a patient, let's say, treat her BCL6 level, have a baby, then come back a couple years later, and then we repeat the BCL6 and the level is high again or even higher than it was before. So I would repeat that test. The endometrial receptivity assay, I don't need to repeat. It seems to be reproducible over years. So I've had patients who've delivered baby number 1, Receptiva was normal, and then delivered baby number 2 with the same protocol that I use based on the ERA test for number 1. So for those of you who are joining right now, the ERA test is what I also call your Evite for your embryo party. So that's exactly what it is. It tells you what time that embryo should show up and what time that embryo should show up for the funnest party of your life. And that's kind of how I think of things. So that's a really great question, Christy. And do you have any other questions about this that I can answer?
I don't think so. That was really helpful. Thank you so much.
Okay, you're welcome. And you're more than welcome to call back. We're going to do another call-in, and be sure to reach out to me, because what we could do is I'd love to hear what your levels were and see what you did and your outcome. I think it would be super helpful for the listeners as well. So thank you, Christy, for calling in tonight.
Definitely. Thanks again. I appreciate it.
You're very welcome. So this has been an exciting week in the news. Last week on Tuesday, there was a report for the Center for Health Statistics. And what that study showed was that the fertility rate in this country was at its all-time low in the last 30 years. So in 1987, we had the same birth rate as we did last year. And so you're asking yourself, wow, that sounds doom and gloom. But the answer is, honestly, the drop was only 2%. And what was most interesting to me is that the fertility rate, which means the birth rate, went up for the group that was the oldest. So that's 40 to 44. So what that means is society is definitely changing. Our biology hasn't, though. And so for me, I just want everyone to know about fertility screening, how you can learn about your levels, get ahead of your fertility, freeze eggs, but also freeze embryos. So you hear so much about freeze your eggs, freeze your eggs, freeze your eggs. But we should also talk to families who are thinking about having more than one kid, who start, let's say, over the age of 35, about freezing embryos for their future family. So I hope that's helpful. So I'm going to just check over here with my producer, Paula, and see if we have another caller right now.
We do.
Awesome. So we're going to bring on another caller. Hello, caller. This is Dr. Aimee. How are you tonight?
Hi. Great. Thank you.
Awesome. What is your name?
My name's Anna, and I live in Texas.
Awesome. Well, welcome to the show, Anna from Texas. So tell me your fertility story, Anna.
Well, our fertility story begins 2 years ago,
Okay.
when my husband went to check if he was fertile or not, and he did a sperm analysis and was sent on his way with a good number, and said that he was very fertile. And we began trying, and we got pregnant. We were very excited, and we had a miscarriage at 12 weeks. There was a missed miscarriage at 9 weeks, and nobody thought much of it, and then just told us to try again. So we tried again and had another miscarriage at 5 weeks. After that, I was told nothing was wrong and to try again, but that wasn't good enough since we're both in medicine, so we tried to do some testing.
Okay.
We tested me for basically everything on earth, and everything came back normal.
Got it.
And they just said, there's 2 flukes, please try again.
Okay.
So then we tried again,
Okay.
and we got pregnant again.
Right.
And again, lo and behold, lost the baby at 5 weeks. At that point, I did some more research and tried to basically get him to see a urologist to do a what's called DNA fragmentation test,
Right.
which showed that he had 33% fragmentation there,
Mm-hmm.
and it was, possibly an issue. Then we actually got pregnant again because several reproductive endocrinologists said that it was not an issue at all, and
Right.
it was inconsistent studies, et cetera, et cetera. And we just actually found out 3 days ago that our baby has anencephaly, and we have to terminate the pregnancy, which even worse so, Texas has put in a law that refuses any kind of termination coverage for any reason, be it absolute fatal diagnosis or not. So
Right.
here we are, suffered 4 losses with complete shock in the last one. And my question is, why is DNA fragmentation not recognized? Nobody's testing for it. And what can we do about possibly spreading the awareness? Because it definitely is a real issue.
Well, Anna, thank you for calling in, especially at this time when you're going through so much. You're obviously a very caring and generous person because you want to share your story. I imagine you're calling in because you want others to hear from you, learn from you, so they don't suffer in the same way. Is that right?
Exactly.
Yeah.
I just want, so many people to be aware of this test, because all I hear is stories about multiple failed IVF rounds where, many endocrinologists don't test for it and say it's inconclusive. And I see so many stories of people suffering, and here we are, no PGS screening would have tested for anencephaly.
And the DNA fragmentation as well. And that's the thing, is when people see DNA fragmentation, first of all, I'll tell you that you were very smart to ask for it. Okay. And it's part of when you hear me talk about the Tushy method, and not to be silly or, make light of what you're going through. The S of the Tushy method is sperm health. And part of the testing that I recommend is DNA fragmentation testing on top of a semen analysis. A very smart urologist in our area here in the Bay Area said, and I quote him when he said, you can't judge a book by its cover, and you can't judge sperm health by just how fast it moves or how it looks. And so we have tests, unlike for eggs, like we can't look at someone's eggs under a microscope because women don't have the luxury of being able to put them in a cup. But it's so simple for men to do. It is such an easy test. And the studies are robust about DNA fragmentation and the effect and the increased risk of miscarriage and the decreased chance of live birth. And what's so difficult is also for patients who, let's say, go through IVF, do the PGS testing, and they still have miscarriages. That can be from DNA fragmentation as well. So the good news is, unlike for us women, how we're just born with all the eggs that we'll ever have. For men, there's an opportunity to improve things, right? And so there's a sperm life cycle. It's around 70 days or so. And so I ask guys to go through a fitness challenge. And then as soon as his sperm's really good, it's so easy to freeze the sperm too. I want you to be wildly successful in your future family. I want you to have everything that you want, given the number of losses, heartbreaking losses, especially with what you're going through right now. So let's say you get your husband's sperm DNA fragmentation down, and you certainly could through, making sure he has a healthy BMI, following a really nice diet full of healthy greens, low fat, and he can even meet with a nutritionist, see a urologist to evaluate for a varicocele, get his testosterone level checked, decrease stress, and avoid heat exposure. So all of those things can potentially decrease the DNA fragmentation rate. And so once his DNA fragmentation rate, let's say, is in a good range, you can freeze his sperm for future babies, and freeze a lot of it. For example, if you're going to end up doing, let's say, IUI, unless you're thinking of doing IVF. So I'm not sure why doctors don't believe in DNA fragmentation. For me, it's not about faith. It's purely about science. And you can actually see the DNA fragmentation levels go down over time, and you can see people's success rate go up over time as far as pregnancy. So that's the goal of doing all this testing up front. And my heart breaks that you've been through so much. And the other thing that I wish that more people did is they use each pregnancy as an opportunity to learn about what's going on with you, right? So let's say, that first pregnancy that you had that was a miscarriage. So for me, in my practice, miscarriages are my number one least favorite thing. They're like the worst thing ever. Then come negative pregnancy tests after IVF, and then third come periods, right? So for me, those are my enemies, miscarriages, and those are the things that I despise, okay? But it also bothers me when people have had the number of losses that you've had without genetic testing. And so each pregnancy that you had was an opportunity to learn about what was wrong. And I feel like that as women, we're just told, oh, it's just because it's abnormal and try again, just like they told you. And I wish people knew more that you can actually test pregnancy tissue, find out the chromosomes, and that can guide you as far as what's going on. If the chromosomes were normal, then you go down one path. If the chromosomes were abnormal, you can go down a different path. And certainly you have one of the factors that are causing what you've been going through, but it's possible that it could be other things as well. So what have they done? You mentioned that they did a workup for you. Did they look at egg health for you as far as your AMH level?
They looked at my AMH. I think I want to say it was 2. We both went through karyotyping.
Yep.
We both went through like a 300 disease pre-genetic screen panel, which was all negative.
Right.
They did not do the genetic testing on the first baby, but we did a maternity test, and it was chromosomally normal from those tests initially.
So that's
so this baby was also chromosomally normal from the maternity test as well.
Got it.
So it's kind of like, just happening.
Right. So for you, it seems like the DNA fragmentation is the single most likely cause of the losses that you've had over all this time. And if it was something that you had known earlier, you could have done something about it. And to know it now is really unfair. And I'm sorry.
Me, the most appalling part is that, these are not mom and pop reproductive endocrinologists.
Right.
We live in Dallas, and the head of UT Southwestern, which is a leading institution, did not believe in DNA fragmentation. Another physician that is Harvard educated, trained, does not believe in DNA fragmentation. Third one, no one, until I did research myself, found you and a few other physicians that actually know about this, and I was appalled to see the answer. So it's just, the problem is really global,
it is
very,
global.
very appalling.
50% of every embryo is a sperm cell. 50%, right? I mean, that's the reality of it. And so we spend so much time getting poked and probed, and there's so little effort spent on the male part. But I think that things are changing over time. So let's say 10 years ago, we used to think, as long as it's a sperm cell, you just put it in the egg and it should turn into an embryo, and it's all up to the egg. But we've learned so much over time. And the DNA fragmentation test is really a tool in the toolbox of all the very best male fertility specialists in our area, especially. So I learned from them, and they guide me. I also follow the research. So your gut is definitely right. And I do think that there are opportunities for the DNA fragmentation to improve. And I hear just from your voice that you're not going to give up until you have your family. And I would love to hear from you in the future. And if there's anything that I can do to help you, I'd like you to reach out to me and let me know. Okay?
Thank you very much.
You're very welcome. Thank you, Anna. Thanks for calling tonight. So
have a great night.
Thank you. Same to you. So tonight we heard from 2 callers so far. One was Christy. She was asking about, endometrial testing. And for those of you who don't know about the Egg Whisperer diet, that's something that I recommend. Diagnosis, IVF, endometrial testing before your transfer. And our second caller, Anna, called about DNA fragmentation testing. And that's part of the S of the Tushy method. So tubes, uterus, sperm, hormones, and your genetics. So it's important to look at sperm quality as well as dive deeper into sperm health depending on your situation. So these are easy tests that you can do. So my producer Paula is telling me that we have another caller. Hi caller, this is Dr. Aimee. How are you tonight? Hello caller.
Hi.
Hi, this is Dr. Aimee. Thanks for calling in. What's your name?
Hi, my name is Krupa. I've been waiting to talk to you.
Thank you, Krupa. Thank you for being a follower and a fan. So tell me your fertility story.
Okay, so my husband and I have been trying for almost 4.5 years.
Okay.
And many failed IUIs and 2 majorly failed IVF.
Okay.
And I just went through 3rd IVF cycle like 2 weeks ago, and I have 1 frozen embryo.
Okay. Did you genetically test that embryo?
Sorry, I couldn't hear you.
No problem. Did you do genetic testing on that embryo? Do you know if it's chromosomally normal?
No, we decided not to because we just had 1. So
Okay.
we wanted to take chance because with past 2 IVF, we didn't even reach to even frozen embryo status.
No
so
problem.
This time we at least have 1 frozen embryo. So we were just too excited and, you know, taking a chance to
Of
just
course.
transfer
No,
it.
I understand. And did you end up transferring this embryo for the 3rd IVF cycle, or is it frozen right now?
It's frozen right now.
Okay, great. And do you know the quality?
Yes, it says it's 3BA.
3BA. Is it a day 5 or a day 6?
Day 6.
Great. Okay. Well, a 3BA, I'd say it's a good to fair quality embryo. Is that what your doctors also told you?
Yes.
Okay. So what kind of pregnancy rate did they give you for this quality embryo in their lab?
They haven't told me anything as of right now.
Okay.
I have an appointment with my doctor on Tuesday.
Okay.
So we'll discuss further then.
Okay.
But this is so far, this is what we've learned.
Okay.
That it's a 3BA. Yeah.
Okay. And then what do you think the difference is? So you've done 3 cycles, no embryos in your first 2 cycles that were viable enough to freeze. And now in your 3rd cycle, you had 1. What was the difference in the protocol that you did?
So the first 2 protocols, I was, because I am diagnosed with DOR.
Got it. Okay.
And so first 2 protocols, I think the medication-wise, it was exactly same, but I was put on birth control pills, which was, I guess, suppressing my ovaries even more further.
Okay.
And this time, my doctor went with my natural cycle.
Mm-hmm.
So no birth control pill, but I also started with Clomid.
Mm-hmm. Mm-hmm.
And then went on taking Menopur and Follistim.
Got it. Got it.
And Omnitrope as well.
Okay. So what you're saying is that by using a natural cycle start, you were able to have a better response. So share with me a little bit more about your DOR. And for those of you who are watching who don't know what DOR is, DOR stands for decreased ovarian reserve. Okay. And so what are your levels? So what's the highest FSH level you've ever had?
Highest I ever had was 15. Okay. But it dropped down to 12.9.
Okay. And then what about AMH?
AMH level is 0.9.
Okay. Okay. And then
and I am 31 years old.
You're 31? Is that what you said?
Yes.
31.
Yes.
And then what's your antral follicle count?
I don't know that as of right now, but I think they told me like about 4 or 5.
4 or 5. Okay. And then how many eggs did they get in this last IVF cycle from you?
They got 6 eggs.
6 eggs. Okay. Well, there's a lot to be hopeful for. I mean, I'm so happy that they chose to do a natural cycle start for you. And for me, birth control pills, for those of you who are watching who don't know what birth control pills are used for in IVF cycle, we use them as IVF readiness pills. And so birth control pills in women who have less than a certain number of eggs can definitely suppress the ovaries. And studies have shown that if you use birth control pills, you will actually get less eggs compared to women who don't use birth control pills. And so when every egg matters, obviously using birth control pills can affect how you respond to the medication and can be the difference between getting 1 embryo or no embryos, just like Krupa is describing to us tonight. So Krupa, tell me more about your story and what's your question for me?
We're desperately trying to have a family. It's been almost 4.5 years that we're trying with all the failed cycles and everything. Financially also, just paying everything out of pocket. Like I don't want to lose hope, but what are my chances of conceiving with my own eggs and what I can do to improve the quality of my eggs if the cycle doesn't, it's not successful.
Right. So let's just go through things systematically. So number 1, have you had your fallopian tubes checked?
Yes.
Okay. And they're normal?
And yes, they're normal. They're not blocked at all. I have had hysteroscopy done before. Excellent. My uterus has no polyps, nothing.
Perfect.
It's clean.
Okay. So tell me about sperm health. Have you done DNA fragmentation testing? Have you done any advanced sperm health tests?
Yeah, we have done sperm analysis, but no DNA fragmentation or anything. And every time it came back really normal. His motility is perfect and everything.
Okay. When you say perfect, a lot of times we sugarcoat things for men. I'm just being way upfront and super transparent. And we tell guys, oh, everything's great. Can you be a little bit more specific about the numbers, just in general? Like, is his total motile count over 40 million, under 40 million? What kind of counts are we talking about when you say it's great?
It is a little under 40 million.
Okay.
I don't have his exact number with me.
No problem. No. So I think it wouldn't be a bad idea to do a DNA fragmentation test. The company that I use is ReproSource, and it's a DIY test, do it yourself. They ship you a tank. You arrange for the shipment. You load the sample up yourself. You follow the instructions. You ship it back. You usually get results within a week. So I think it would be super helpful because, again, every embryo equals 1 egg and 1 sperm. So you've gone through all these tests. We've put him through a semen analysis. Let's learn a little bit more while we can so that we can decrease your time to pregnancy and decrease the number of treatments that you have to use, because it would be pretty awesome. Because so far you haven't told me anything that tells me that you cannot get pregnant naturally on your own. So you're asking really good questions. And when was the last time you had your hormones tested? As far as your AMH, your FSH, and estradiol, when was the last snapshot that you got of your hormones?
It was on August 11th, 2017. This time my doctor didn't want to do it because she already knows that I have DOR and stuff. So she's like, you know, it's low and stuff. So she didn't want to have it tested and me worried about it even more, you know, if it's dropped down a little bit more.
Right. So I appreciate that. You know, I appreciate her not wanting to be doom and gloom for you. But my approach is, let's find out. Let's learn more about what's going on. Let's get this information so you know what's happening with your fertility. So, you know, to have it checked August 2017, and now we're here in, you know, almost June of 2018, it makes perfect sense to check them again and see what's going on. So for me, I check the FSH, estradiol, AMH, the AMH about every 6 months for my patients, the FSH, estradiol almost with every cycle start if they're in treatment, because I want to learn about these patterns. The brain to ovary signaling is really, really dynamic. It's always changing. And I want to see what the trends are for my patients, because I want to know when is it a good opportunity to move forward, when we shouldn't move forward. So I'm always doing these check-ins, FSH, estradiol, antral follicle count. I bring patients in, and my theory is, or approach is, let's be as aggressive as you feel comfortable being. And it doesn't have to mean doing IVF, but it certainly can mean, let's say, taking fertility pills, helping you ovulate more than 1 egg, and then trying at home or trying with IUI. So with this next period, I would definitely consider doing another FSH estradiol check. And then you mentioned, did you do hormone testing? Sorry, not hormone testing, but did you do a genetic screen, an extended carrier screen, looking at your reproductive genetic profile as well? Have you done any of those types of tests?
Yes, we have, and everything came back normal.
Okay. So there are fertility genes that you can have tested as well. Have you done those?
No.
No. So there are a number of companies that do that test. One that comes to mind is the Fertilome test, myfertilome.com. So that's a test that I think might be useful because, you know, right now we're thinking, oh, it's all related to the eggs. But what if there are other things going on that we should be addressing as well? So looking at your full DNA profile related to your reproductive potential, I think would be really helpful, especially since you've gone through so much. I mean, obviously I'm recommending things, and, you know, I'm just worried because all this stuff kind of adds up on the cost. And that's why I like to do these kinds of tests up front, ahead of time, before people start treatment. So I'm thinking that if you do another FSH estradiol, if you do a DNA fragmentation test for your husband, and if you do the fertility gene test, I think you'll have a really good full picture as to what's going on. And so far, you haven't told me anything that tells me that you guys can't get pregnant naturally at home, especially because you just recently made a really beautiful blastocyst with your last IVF cycle. So if you were my patient, what I would recommend is a really healthy lifestyle, making sure that your BMI is normal. If it's not, get your team around you, personal trainer, a nutritionist, supplements. I talk to a lot of my patients about taking supplements and different types of supplements that might help with egg quality. Are you on any right now?
No, I'm just taking prenatals.
Okay. So a couple of things that I would have patients of mine consider. So acai berry, resveratrol, melatonin 3 milligrams at night, ovositol, CoQ10. That's just a handful. I don't recommend. There's a supplement also called DHEA. I don't recommend that to everybody, but there are some patients that are a candidate for that hormone. But it can cause some side effects that may actually hurt things. So I always check a baseline testosterone before I start that supplement, and then certainly if patients have symptoms of high testosterone, or if they are pre-diabetic or are a little overweight, I won't start that supplement at all. What about acupuncture? Is that something that you've explored at all?
Yeah, that was going to be my next question. Like, should I be doing acupuncture? Because most likely I might have a transfer in 2 months. So how should I prepare for it? Acupuncture, I should be doing acupuncture?
Yeah, I mean, I love acupuncture. It's just another opportunity to have another cheerleader on your squad, so to speak. And that can only help. It's just nice to have someone else, another shoulder or another ear to listen to you, another shoulder to cry on. Not that I want you to cry at all, but they can also just help you relax. Is it possible that it might improve blood flow to the uterus? Is it possible that it's going to relax the uterus? Yes to all of those things. So it can't hurt. It can only possibly help, and only do it if you feel really good about it after you leave your session. So I would say if there's an acupuncture center that's close to you, convenient, someone who's fertility trained, I would take advantage of that and see if you find it helpful. Okay. And so,
Perfect.
You heard me talking with the first caller maybe about the endometrial testing. And so that isn't a bad idea for you to do. Even though you didn't genetically test your embryo, consider doing the endometrial lining check with a mock cycle and looking at the ERA test as well as the receptiva test. So those are two things that you can still consider doing. You want to treat that embryo as if it's genetically normal and give it its very, very best chance for pregnancy. So I still consider those tests and talk to my patients about those tests, even if they haven't genetically tested their embryos. And then the other thing is, you've done 3 cycles. The third one resulted in a blastocyst. I know financially it seems like impossible, but have you considered doing another cycle so you have, basically another chance at a future pregnancy?
Yes, we are considering that.
Excellent.
We've been through a lot, so we just want to take this one day at a time and still not give up. Like with the cycle, we now have more hope that I was at least able to reach to a point having one embryo. With past 2 cycles, we were devastated. Like, the first one, I was sitting in a transfer room and my doctor comes in and is like, "Oh, we have no embryos to transfer."
You found out in the transfer room? That's the worst. I'm sorry.
Yes, that was the worst. I didn't even know how to take that.
Right. I'm sorry. Oh, yeah. So my other suggestions are HGH. Have you ever taken HGH before for any of your cycles? Human-derived growth hormone?
Yeah.
You have? Okay. You took them for all 3 cycles or just this last one?
All 3 cycles.
All 3 cycles. Okay. So, it could be that there was a cumulative benefit, believe it or not. It could be that you were taking it over time and that it just helped in this 3rd cycle as well. I know you made those changes of doing a natural cycle start, but it's possible that taking the HGH over that period of time might have helped. So one other strategy that I use with my patients is HGH priming, where you take it, let's say Monday, Thursday, up until when your next cycle starts. So that's something else to consider also. So basically, my recommendations for you, just to summarize, are to repeat your hormone levels, get the DNA fragmentation checked, consider doing HGH priming before your next cycle, and please do keep in touch with me. I'd love to hear about your outcome and what happened. I'm sure our listeners would as well. We're all cheering you on, Krupa. Thank you for calling in tonight. Did you have any other questions before I sign off?
No, is this supplements okay to take it up until transfer, all the supplements you mentioned?
Yes. So for my patients, and again, I want you to talk to your own personal physician, but for my patients, I ask them to take them up till the transfer, unless they bother their stomachs. But none of the supplements would interfere with the pregnancy.
Okay.
Okay.
Thank you, Dr.
You're welcome.
Aimee. It
My
was
pleasure.
really
My pleasure.
Thank you, Krupa. Hope to hear back from you with some really positive, great news soon. Okay, so we're almost done for the night. We have one more caller who's calling in to the Egg Whisperer show. Thank you guys for tuning in. We've had a lot of awesome questions. So I'm going to take the caller now. Hi, caller. This is Dr. Aimee. How are you? Hi, caller. Are you there? No? Okay, well then I'm going to have to sing my Salt and Pepper jingle. I don't know if you guys watched the Billboard Music Awards, but there was some good music on that during that, and it brought me back to the good old days from the 90s. I know I look 25, but I'm in my 40s, and I can tell you I was busting a move to Salt and Pepper. And they were singing some songs, and I think that I'm going to have a song that goes along with those songs, so I'll have a medley for you next week. So you better tune in, because I'm totally serious, because I'm going to be singing some Salt and Pepper here next week. So I hope you guys have a great night, and thanks for tuning in. And I am sending positive pregnant thoughts to everyone out there tonight who's dealing with fertility issues. Have a great night. Talk to you guys later. Bye-bye.